We are conducting a study about occupational therapists, or OTs, who work in early intervention, or EI. Specifically, we are going to find out if OTs are knowledgeable of the competencies in EI.
Competencies are the knowledge and skills that a professional needs in a specific area in order to provide high-quality care to the individuals in that setting. For EI, there are several competencies for all professionals who work in that field, not specific to one profession. The Division of Early Childhood, or the DEC, and the Early Childhood Personnel Center, or the ECPC, are responsible for laying out these competencies that apply to all professionals who work in early intervention.
However, some professions took these overall competencies and tailored them to their specific practice. For example, speech therapy and physical therapy published their own competencies based on these competencies for their specific professional workings in EI. OT has not done this. It is AOTA's position that every OT who is registered is qualified to practice in EI with no specific established competencies for OTs working in EI. These leave an assumption that OTs will be adhering to these competencies that are not officially in the curriculum. Therefore, there is insufficient evidence to support whether OTs know these competencies or are practicing them, since they are not mandated. Based on the literature review, OTs in the field may not be adequately prepared to work as effective EI practitioners based on the competencies.
We are going to recruit by means of convenience sampling. From online lists and social media pages, we are asking 8,000 EIOTs to participate through posts and emails. We are aiming for 5,000 participants to give informed consent to be surveyed on their understanding of the competencies in EI practice. We are also going to use snowball sampling by asking the therapist to refer the survey to other EIOTs if they know any. Participants will take the survey themselves through the Qualtrics link. We created the survey dividing it into two parts. Part 1 asks therapists their demographic information such as location, experience in EI, and exposure to the competencies. Part 2 asks therapists about their knowledge and practice of EI competencies. Later, each question on the demographic information in Part 1 will be analyzed with their knowledge and practice of competencies in Part 2. This way, we can see if there is a relationship between the therapist's location, education, and experience, and their knowledge of the competencies.
This information we are gathering from the survey will be evaluated and analyzed through SPSS. The survey responses ranging from 1, I have never heard of this competency, to 5, I have experienced this competency many times, can apply it, and have refined my skills in this area. We will perform several correlational statistics, including Kendall's, Spearman's, Pearson's correlation test for quantitative data, and a chi-square test for qualitative data, to analyze our independent variables of demographic information in Part 1 with the dependent variables of the knowledge of competencies in Part 2 of the survey. Results may show a relationship between location, education, and experience on the competencies to knowledge and practice of EI competencies. Additionally, we might find out if there is a relationship between knowledge and practice of EI competencies and having prior education on these competencies. The study may provide information and implications on future training and education in EI for EI occupational therapists.